Laser comb is used in as a second or third line treatment who cannot use the medicines either for fear of side effects or because of side effects, or in patients whom medicines do not work. In patients who cannot do PRP or it is not working, doctor, I don't want to take drugs. I can't come to the clinic again and again. Is there any treatment for me? Doctor, I heard laser can work for hair loss. Is it true? To answer these kind of questions which are asked by patients, I am Dr. Venkataram Mysore, dermatologist, hair transplant surgeon, Venkat Center for Skin, ENT and Plastic Surgery, Vijayanagar Banashankari, Cunningham Road, Bangalore. Generally, there is a hesitation to take drugs for hair loss. Surgery is applicable only after a certain amount of hair loss has happened. Biological treatment such as platelet-rich plasma needs repeated visits to the clinic. So, there is a craving or a desire to have some treatment which patient himself or herself can do sitting at home. Without drugs, without injections, without surgery. What is the treatment? One possible treatment is laser. Laser is a type of light. That light, when it goes into the skin, it is said that it can stimulate the root, the stem cells, improve the blood supply, enhance the growth phase or the anagen phase of the hair, and thereby increase the thickness and length of the hair. This is the principle. But is there such a machine? Yes. Several different technologies have been discovered. One of the best known treatment is low level laser or biostimulant laser. Here a diode is used to deliver energy at a very low fluence or low energy levels, which is delivered into the skin. How is it delivered? It can be delivered through a comb like machine, you can see here, called laser comb, or it can be used through a laser helmet, as you can see here, or a laser cap. You put it on or you comb it for about 5 to 10 minutes every day. Patient sits at home and does it. And it has to be done for 6 months, 1 year, 2 years, like that. Does it work? This is not a new treatment. This is old, about 15, 17 years. Its attractiveness to patients is that there is no drug and you can do it at home. But how much does it work? There have been 10 to 12 papers on this subject, small number of patients, and that shows it does seem to work in early hair loss, stage 3, stage 4, like that. It can also work for temporary hair loss, telogen effluent. It does not work for advanced hair loss. So, what is its position? According to the European guidelines, S3 guidelines, as you can see here, it is classified as level B evidence, which is a good level of evidence. But according to Indian guidelines, you can see here AHRS guidelines, it is level C, which is a little lower level of evidence. What it means is, it seems to work to some extent, but not greatly or significantly. So, it is not a first choice treatment, it is generally a second or a third choice treatment. So, that is about laser comb. Is there any other type of laser? There is a company called Photona which has a number of lasers. They are pioneers in a laser called erbium YAG laser. In that, in one of the modes with a handpiece called PS03, they first inform that this level machine can produce some hair growth. The mechanism was the same, improves blood supply, stimulates stem cells, stimulates anagen phase, and so makes the hair thick and long. We have this machine in our clinic, as you can see here. We tried in about 15 patients, found that in small patches, after about 4 sessions, it can stimulate hair to some extent, 40 to 50%. 100% is not seen, 40 to 50%. The treatment was painless, treatment was very, very safe. There were no complications. You can see some of the results. So, when do we use it? We use it in patients who are not responding to other types of treatment or who do not want to take drugs. In them we use it, small patches. We also use it on the beard for alopecia areata. There also it can work. Then, there is a third type of laser which is called fractional laser. There are 2 types here, fractional CO2 laser, you can see the machine here. Fractional erbium laser, you can see the photo. These lasers, when they are delivered onto the skin, they drill tiny, tiny holes in the skin. You can see here, small, small dots. Once this is done, it is easy to put medicine on the skin and deliver it right down to the depth you need. So, you can put minoxidil on these holes, you can put PRP on these holes, and thereby it may work better. So, this is called fractional drug delivery. That also is possible, and that also helps in patients who are otherwise resistant to treatment. We also do this treatment. So, now I have told you 3 different types of technologies. What is their position? How to use it? Laser comb is used in as a second or third line treatment who cannot use the medicines either for fear of side effects or because of side effects, or in patients whom medicines do not work. In patients who cannot do PRP or it is not working, we can use it as a third option. Usually it is an adjuvant option along with other treatments. We also use it for people who stay abroad because abroad PRP is extraordinarily expensive. We also use it in sudden acute temporary hair loss called telogen effluvium, which happens after dengue, malaria, etc. It's a wonderful, calming, soothing, safe treatment. The photon laser we use in resistant patches, small patches, patches of alopecia areata. It is still a new treatment. We need more evidence before we recommend it to everybody. Fractional drug delivery again can be used in drug patches, resistant patches. We use it more in what is called scarring alopecia, wherein the hair loss is due to destruction, such as happens after burns, after injury, after some diseases called pseudopelade or lichen planus. We can use it there also. We use fractional laser before we do transplantation into a scar. That helps to improve the blood supply. You can see here how hair loss can happen into a scar and then how growth can happen after transplantation. These are the ways we can use laser. So, what does this all mean? It means new technologies are emerging for treatment of hair loss. It is the doctor's job to evaluate them correctly, determine their efficacy and evidence, and then advise appropriately to the patient. But patients should be careful not to be lured by exaggerated advertisements. There are centers which are causing advertising for laser for hair loss 1 lakh rupees and 1 lakh 50 rupees. Be careful. It is not a treatment which is worth so much money. Instead, you can do transplantation. Seek proper information from qualified doctors. At Venkat Center, we have all these modalities. Hope you have liked the video. Please share it. Visit our website venkatcenter.com and please give your feedback. Thank you very much. Good day.